Updates in Lab Medicine. This report is focusing on the Industry 4.0 shift in laboratory medicine. It follows a professional yet engaging structure suitable for healthcare professionals, students, or tech enthusiasts. The Silent Revolution in Lab Medicine. Intro. Most of us think of a medical lab as a room full of microscopes and manual test tubes. But right now, we are in the middle of Industry 4.0, a silent revolution where laboratories are no longer just supporting care, they're directing it. From AI that acts as a diagnostic partner to blood tests that detect Alzheimer's years before symptoms appear, the lab of 2026 looks nothing like the lab of 2010. Today, we are breaking down the most recent advances in laboratory medicine. Segment 1, AI, from Copilot to Diagnostic Partner. The biggest headline is Artificial Intelligence. In 2024, we saw AI acting as a copilot for reporting. By 2025 and 2026, it's becoming a full-fledged diagnostic partner. Augmented diagnostics, AI is now used for auto-verification, reducing invalid reports by up to 80%. Predictive power, beyond just reading results. AI models like OncoNPC are being used to predict the primary origin of cancers of unknown primary, CUP, with high accuracy, helping doctors choose the right treatment path. Image analysis, in pathology and microbiology, AI algorithms are identifying malaria parasites in blood smears or abnormal cells in pap smears faster and with higher sensitivity than manual microscopy. Segment 2, the Multiomics and Liquid Biopsy Explosion. Host, we've moved past simple blood counts. We are now in the era of multiomics, integrating genomics, proteomics, and metabolomics into a single patient profile. Liquid biopsies, this is a game changer for oncology. Instead of invasive tissue biopsies, labs are using blood tests to detect circulating tumor DNA, ctDNA. This allows for real-time monitoring of how a tumor is responding to treatment or detecting a relapse months before a scan would show anything. Frontline Alzheimer's testing. One of the most significant breakthroughs in 2024 was the scaling of blood-based biomarkers for Alzheimer's, like the PrecivityAD2 test, which can identify the disease with 90% accuracy, potentially replacing expensive PET scans or invasive spinal taps. Segment 3, Hyperautomation and the IOMT. Laboratories are facing a massive labor crunch, and the solution is hyperautomation. Total Laboratory Automation, TLA systems like the Roche Cobas or Abbott Accelerator can now handle the entire process, sorting, decapping, aliquoting, and archiving, without a human ever touching the tube. The Internet of Medical Things, IOMT. We now have smart consumables and instruments that talk to each other. Imagine a lab where the centrifuge automatically alerts the technician's phone that it needs maintenance before it breaks down. This connectivity is drastically reducing turnaround times. Segment 4, Point of Care, POCT, and Wearables. Testing is moving out of the central lab and closer to the patient. Decentralized testing, we now have rapid, over-the-counter tests that can detect COVID-19 and the flu simultaneously in 15 minutes. Lab-on-a-Chip, these are microfluidic devices that can perform complex DNA or protein analysis on a chip the size of a credit card. Wearable integration, labs are starting to integrate data from patient wearables like continuous glucose monitors or heart rate sensors directly into electronic health records, EHR. This shifts medicine from reactive, treating a sick person, to proactive, preventing the sickness. Segment 5, Challenges and Ethics. not all smooth sailing. With all this data comes the risk of cybersecurity threats. In 2025, the average cost of a healthcare data breach reached over $7 million. There's also the black box problem. How do we ensure AI isn't biased against certain populations? Experts emphasize that while AI is powerful, a human in the loop, a qualified lab professional, is still essential for final clinical judgment. Conclusion and CTA. The future of lab medicine isn't just about faster tests, it's about personalized precision. We are moving toward a world where your genetic signature is a standard part of your medical file. If you found this dive into the future of healthcare interesting, hit the like button and subscribe for more medical tech updates. What advance are you most excited about? Let me know in the comments. Disclaimer: the video is for information sharing and awareness only. Facts must be verified before use. The creator, publisher, and YouTube will not be liable for any incorrect consequences results.